Hello, my name is Dara Leet, and I'm here today to present to you our research on examining trends in drug abuse. I have collaborated on this project with 5 of my fellow classmates, Nicholas Garcia, Melissa Charbonneau, Patrick DeMar, Xavier Betancourt, and Jorge Mendez. We have worked under the guidance and mentorship of Dr. Kathleen Moore, so special thanks to Dr. Moore. First, I would like to provide you with a little background information so that you may understand why we felt compelled to choose the topic of drug abuse for our research. As many already know, over the last 15 years, the state of Florida struggled with operations that infamously became known as pill mills, in which clinics, physicians, and pharmacies conspired to prescribe and dispense large quantities of controlled substances outside of the scope of medical practice in exchange for cash. This illegitimate practice became a major societal burden that led to an exponential increase in opioid addiction, medical costs, and fatal overdoses. In response to this epidemic, new legislature implemented a statewide prescription drug monitoring program in 2011. This was known as the Electronic Florida Online Reporting of Controlled Substances Evaluation, or for short, EFORS, which requires pharmacists to report every time a Schedule 2, 3, or 4 substance is dispensed to an individual. This initiative was intended to encourage safer prescribing, reduce drug abuse and diversion, and also prevent individuals from filling multiple prescriptions at different pharmacies throughout the state. EFORS was quickly considered to be a huge success, with drug-attributed death rates in Florida declining 23% by 2012. However, the seemingly positive trend does not appear to hold true in present day. A more recent 2005 Medical Examiner's interim report reported that total drug-related deaths in Florida are on the rise again, increasing by 13.9% in 2015 when compared to 2014. Also in the same time frame, mortality specifically due to heroin abuse was shown to increase by 114.8%. Thus, it is proposed that the more stringent regulations imposed on the procurement of prescription medication has not accomplished its goals of decreasing illegal drug abuse, but have instead simply shifted the trend in drug of choice from prescription painkillers to other drugs. It is suspected that such a shift has actually served to increase drug-related deaths in Florida, suggesting that healthcare professionals are inadequately equipped to treat addiction. Further investigation into this epidemic is necessary to allow for healthcare professionals to provide safe and effective care for patients. So we have a couple of objectives through our research. Firstly, to discover trends in prescription and illicit drug abuse throughout the years of 2005 to 2015 within Hillsborough County. We would like to explore the circumstances of both prescription and illicit drug abuse so that we may understand how policy modifications, such as the implementation of EFORS, have contributed to more recent trends of drug abuse. Lastly, we would like to identify the role of healthcare professionals in the present-day opioid crisis and future interventions that will allow for healthcare providers to appropriately treat addiction rather than simply shifting the trend of abuse to other substances.
Our project is a mixed methods quantitative-qualitative model. For the quantitative portion, we analyzed Hillsborough County drug-related databases compiled from 2005 to 2015 to determine patterns. For the qualitative portion, we interviewed key stakeholders to synthesize a comprehensive understanding of numerical findings. Both sections were designed to complement each other and their findings. The quantitative databases that were analyzed include Substance Abuse and Mental Health Information Services, Florida Department of Law Enforcement, Department of Health, and Florida Medical Examiner data. For the qualitative portion, the stakeholders that were interviewed include pain management, ER, and critical care physicians and providers, DEA agents, law enforcement officers, pharmacists, and first responders. When examining the databases for the quantitative portion, we looked at patients present in more than one database, and those patients were linked together via their social security number in order to trace individual treatment pathways and outcomes, so we could see them across several databases. The resultant data was examined for observable changes in demographics, treatments received, and patient-specific outcomes over 10 consecutive years, from 2005 to 2015. For the qualitative portion, stakeholders were selected based on professional affiliations and familiarity with the opioid crisis and were interviewed to obtain personal experiences and opinions regarding current policies and potential modifications to prescribing laws that they feel would be appropriate. And now for the results for the quantitative portion. For Hillsborough County Opioid Service enrollment, we summarized that in a chart that showed the total number of individuals enrolled in these services as well as the most popular programs from year to year. So overall, it appears that opioid service enrollment increased around the peak of the opioid epidemic around the 2009 to 2010 era and has since sort of stabilized. So it stopped increasing, but it hasn't gone down to the levels of pre-opioid crisis. Looking at the most popular programs throughout Hillsborough County opioid services, they are intervention programs, detoxification programs, methadone maintenance programs, and individual outpatient programs. While intervention programs have remained the most popular, detoxification programs have decreased in the frequency and have since been replaced by more methadone maintenance programs and individual outpatient programs that have increased in popularity in recent years. When we compared our data to statewide data, the pattern appears to hold true, especially in the opioid service enrollments, as those have greatly increased in the opioid crisis. So there is no significant change from Hillsborough to statewide. Looking at our study demographics, it appears that there has been more of a shift from male to female participants, and with regards to race, it has remained primarily white. However, there has been a slight shift to other minorities as well in those receiving treatment. The average age has remained pretty steady. It dropped slightly at the peak of the opioid crisis in 2010, but has since returned to the levels of the pre-opioid crisis. We also looked at death data for the number of persons who were receiving opioid services who died within 2 years of receiving those services. It has remained pretty steady across the board. However, this only encompasses those who are receiving services and not those who never got referred or forced to participate in these programs. And this data also holds true at the state level as well. And now we will be discussing the qualitative results for the project.
For the qualitative results portion, like Nick mentioned, we interview key stakeholders with different backgrounds and areas of expertise, all related to the topic we were researching. Interview sessions lasted no longer than 30 minutes and included 10 free response questions. In the pie chart here, in our poster, we have included the responses to one of the questions pertaining to the current limitations observed with eForce, which, as mentioned earlier, is an electronic drug monitoring program used statewide here in Florida. Overall, everyone agreed that since eForce started being used, it helped reduce the access to prescription drugs by drug abusers. And as shown in the chart, suggestions to improve the program vary from making it a nationwide program to making it mandatory for all healthcare providers to use eForce.
The number of people receiving any opioid addiction treatment more than doubled from 2005, where 928 patients were treated, to 2010, where 1,993 patients were recorded, the highest amount of patients recorded at the height of the opioid epidemic. Specifically, intervention, detoxification, and methadone services had peaked at this time. However, there was also a steady decline shortly thereafter, suggesting a lack of preparedness to offer treatment for patients of now closed pill mills. The largest demographic of drug users remains Caucasians, aged 18 to 34. Notably, there has been a shift from male to female admittance for opioid treatment, possibly due to the growing awareness of the epidemic. 2-year mortality rates post-treatment declined from 2005 to 2015. This decrease in percent suggests that those who do seek treatment are obtaining better outcomes, but a steadily declining number of individuals are now receiving treatment post-2014.
For the implication section, based on our quantitative data, it seems that there was a temporary increase in numbers of patients in opioid addiction treatment programs. This may be due to crackdowns on pill mills and stricter regulation implementation in 2011. Quantitative data also shows a decrease in patients receiving opioid addiction treatment from 2010 through 2015. This may be due to potential lack of infrastructure that was in place to assist those left addicted with no way to obtain their prescription painkillers. Interviews with key stakeholders have supported the notion that those not receiving treatment have simply found other drugs of choice that are easier to obtain, such as heroin and synthetic fentanyl. More research is needed in how to appropriately train healthcare professionals to adequately treat addiction and prevent future drug abuse.
Future planning. The following are suggested modifications acquired from conducting the qualitative interviews. The first modifications were revolving Florida's current drug monitoring system, or eForce. Such modifications include making the system nationwide, changing update times from 72 hours to 24 hours to deter pharmacy shopping and detect recent use, mandating mandatory checks by all healthcare providers upon initial patient intake, and finally allowing access to HIPAA-trained law enforcement officials to allow better investigation procedures. The second area of modification included implementing more stringent prescribing laws in Florida. Such suggestions included limited opioid therapy to a maximum of 7 days for acute pain or minor procedures, requiring prescribers of chronic opioid therapy to have a special ID or DEA number, and finally, requiring diagnosis codes for all chronic conditions that require long-term opioid therapy over 30 days. Other suggested areas of improvement include allowing more access to interventional programs, such as rehabilitation and treatment programs, allowing easier access to naloxone or other rescue agents, and improving drug formulations to reduce abuse potential.